Hello, I'm Kira. I'm going to be talking about chronic hypoxia and risk for stroke today, and this is for Group 107. So, some things that we look at and think about when we think of chronic hypoxia and risk for stroke is the tetralogy of Fallot, aka right ventricle hypertrophy, VSD or ventricular septal defect, right ventricular outflow, and overriding aorta. So basically, we're looking for a boot shaped heart on the x ray. And what are we going to see? We're going to see crying, poor feeding, and blue extremities because the oxygenated blood cannot make it to the extremities. So hypoxia occurs when there is an insufficient amount of oxygen at the tissues and they cannot maintain adequate homeostasis. Chronic hypoxia is basically that, but whenever it is long lasting because of some sort of defect. It can lead to many complications such as confusion, stroke, difficulty breathing, and TED spells. So, some nursing considerations for treating chronic hypoxia are when the PDA starts to close. This is when the signs and symptoms of hypoxia begin to appear. And we should administer prostaglandin E1 to keep the PDA open. This is a lifeline. Now, when we think TET spells, of course, we learned that knees to chest is the first intervention or priority intervention with a TET spell to increase blood flow. Then we're going to keep well hydrated and prevent infection because it's very common, especially in the respiratory tract. Remember, give me 5. What's give me 5? Knees to chest, stay calm, give O2, give or morphine, and begin IV fluid volume replacement if it's necessary. So the signs and symptoms of chronic hypoxia are blue mucous membranes, blue skin discoloration, blue nail beds, polycythemia, tachypnea, dyspnea, poor weight gain, fatigue, and clubbing. Clubbing would be more of a later symptom. And when we think of stroke, which a stroke is because there is a part of the body that is getting no blood, there will be a loss of balance, blurry vision. There could be some unilateral drooping or slurring of speech. And there will be weakness in the arms and legs. So we need to know that if we're seeing signs and symptoms of a stroke, time is money basically. The more time the extremity does not, or whatever part of the body does not receive blood flow, the increase of the damage that will be done. So here is a child experiencing a TET spell. You can see they're blue on their mucous membranes and on their extremities. These are the areas that get affected first. This is a little picture that we included. Basically, it's talking about what we can do as the cyanosis and hypoxia become more evident and start to worsen. Here is another chart from our book. I'll just let you guys kind of look at that. And here you can see some different things that would cause a child to be hypoxic at the top. Alrighty, and that's all that we have for you guys today. Thank you.